Good morning, good afternoon, or good evening. My name is Kesley Remy, and this week we are going to be focusing on diabetes and digestive and kidney diseases, with me focusing on diabetes mellitus. What is diabetes and digestive and kidney diseases? What are some common diseases in this category? And what is the epidemiology of these diseases? The category of diabetes and digestive and kidney disease includes conditions related to diabetes, digestive system, and kidney health. Common diseases within this category include diabetes, diabetic kidney disease, diabetic neuropathy, and chronic kidney disease. The epidemiology is approximately 1 in 3 adults with diabetes has chronic kidney disease, and diabetes is the leading cause of kidney disease. The prevalence of kidney disease is higher in certain ethnic groups such as African Americans, American Indians, and Hispanic Latinos. Kidney disease is the ninth leading cause of death in the United States, and approximately 1 in 3 adults with diabetes has chronic kidney disease. The National Institute of Diabetes and Digestive and Kidney Disease conducts and supports research on these conditions to help improve overall health. What is diabetes mellitus, and what is the symptoms and conventional treatment? Diabetes or diabetes mellitus is categorized as a disease in which the body's ability to produce or respond to the hormone known as insulin is impaired. There are several ways to help diagnose diabetes, but some of the main common ways include exams such as the A1C test, a fasting plasma glucose test, and an oral glucose tolerance level test. Some of the symptoms include but are not limited to dry mouth, excessive urination, excessive thirst, and fatigue. And the most current conventional treatment for individuals with diabetes is a form of fast-acting insulin, such as Novolog or Humalog, that's taking roughly about 10 to 15 minutes before consumption to help regulate the blood sugar and keep it from reaching dangerous levels. Also, a long-lasting insulin such as Lantus or Basaglar is sometimes taken for individuals with diabetes to help maintain insulin in the body to help regulate the blood sugars over long periods of time. According to the CDC, as of 2023, 38 million people in the United States are diagnosed with diabetes, meaning about 1 in every 10 person. One in every 5 person doesn't have that doesn't know that they are diabetics or can be pre-diabetic. So it's very important that you are visiting your physician frequently just to make sure you can catch anything in advance. The annual cost of diabetes, according to the same report, is 413 billion, including medical costs, surgical supplies, and everything that goes associated with treating diabetes. Diabetes stands as the umbrella overall, and underneath that umbrella it is broken down most commonly into two categories, which is type 1 diabetes and type 2 diabetes. Type 1 diabetes is categorized as a person's body not being able to make enough insulin, while type 2 diabetes is classified as a person's body not being able to use insulin properly, which then leads to insulin resistance. The pathophysiology of diabetes involves elevated blood glucose levels, hyperglycemia, long-term hyperglycemia, which leads to morbidity and mortality rates. Type 1 diabetes is due to autoimmune destruction of pancreatic beta cells, leading to insulin deficiency, and type 2 diabetes results from insulin resistance and inadequate insulin secretion to compensate. Beginning with our first therapy, known as Bitermelin, um, bitter or this first therapy can be known as different things across the board. The most common one is Bitermelin. It could also be known as bitter gourd, bitter apple, or sometimes chlorella. Bitter gourd is found in Asia, South America, East Africa, and in many other tropical regions. Bitter gourd has been traditionally used for its medicinal properties, especially its link to treating symptoms of diabetes. Bitter melon is considered a complementary or alternative medicine, and research has shown bitter melon may be an effective therapy to help treat diabetes because when consumed, it acts like insulin, helping to reduce a person's blood sugar levels as well as lower A1C levels over time. Bitter melon can be consumed in different forms, such as a supplement, tea, juice, or simply prepared as a vegetable to go with meals. The first clinical trial we're going to be looking at was a randomized control study. This study was conducted from about January 2028 to about June 2028 in Pakistan. There were about 50 participants, 50 patients between the ages of 30 to 60 years old, broken up into three separate groups. Group A served as the control group. Group B compromised patients following uh, rosiglitazone, which is an anti-diabetic drug, and Group C following bitter melon treatment. The methods was as follows. Group B was taking the anti-diabetic drug in doses of 4 milligrams, divided into two doses. Group C was taking bitter melon juice 3 times a day, resulting in about 55 milliliters a day for 3 meals, about 15 milliliters each with breakfast, lunch, and because decreased physical activities of the dose because of decreased physical activities, the dose was increased in the night to about 25 milliliters. And the results was as follows. The patients following the anti-diabetic drug treatment showed significantly high serum in sialic acid concentration as compared to the control subjects. However, the patients following the bitter melon treatment showed no significant increase in sialic acid and glucose concentration as compared to the control subjects, suggesting an effective anti-diabetic activity of bitter melon in the management of diabetes. The only limitations was that it was a small sample size and the duration of the study. And the safety was a slight spike in cholesterol levels, but cholesterol levels still remained in range. The second clinical trial we're going to look at is a randomized control study. This study was conducted over the course of 3 months in Taiwan. The participants were 142 participants over the age of 20 years old. Subjects were patients who collect repeat prescriptions of medications for chronic diabetes from local pharmacies under a government-supported diabetic management program. 64 subjects were randomly assigned to the test group, 78 subjects were assigned to the control group, and the participants had either a fasting blood glucose level of at least 140 milligrams or an A1C level of about 7.0%, and had been diagnosed with diabetes for at least 1 year before the study commenced. The methods was as follows. The control group was given capsules of bitter melon peptide with the brand name Insumet. The study subjects were advised to take one capsule before lunch and dinner each day and not to take them within 30 minutes of other medications for a total of 600 milligrams daily of consumption. And the results were as followed. The paired t-test results of the biochemical test before and after the intervention showed no significant difference in the control group, in which the average fasting glucose was roughly 124 and the A1C was 7.5. However, there was noted that there were significant changes were found in the fasting glucose level and A1C for the test group. The paired test results showed the fasting glucose levels for the test group decreased from 136 to about 118, and the A1C dropped from 7.8 to about 7.4. The only limitations of this study was the number of subjects wasn't representative of the entire population of the patients in Taiwan, and the experiment only lasted about 3 months, so there was a lot of information that wasn't included within the experiment. And in regards to the safety, there was no significant safety issues reported in the experiment. The final clinical trial we're going to look at for Bitumelin was a randomized control study. This study was conducted over the course of 1 month in Malaysia. There were about 142 cases involved in the trial. 105 males and 37 females were divided into 3 different categories to gauge results. The 3 categories were age, duration of diabetes, as well as severity of diabetes. And the method was a herbal anti-diabetic medicine and daily supplement containing polypeptide K, which exists in the seed of what we know as bitter gourd, was prescribed to the patients. All 3 categories of age range, young adult 21 to 40, adult 41 to 60, and elderly 61 to 80, was also demonstrated satisfactory blood glucose reduction after taking Diabegard, with adults having the highest reduction. Based on their duration or having diabetes mellitus, category 1 had the greatest percentage of blood glucose level reduction at 35%. And category 1 were individuals who were diagnosed with diabetes from 0 to 10 years old. And the last, based on severity of the disease, category 5 diabetic patients showed the highest percentage of blood glucose reduction at around 49%. And category C cases were individuals who had A1C levels from 13.9 to about 19.4, which was extremely severe. The limitations was the duration of the study lasting only about 1 month. And the safety, there were no known side effects according to this experiment. So overall, the evaluation of Bitumelin used as a therapy for diabetes mellitus stands as this. The first study group took 55 milliliters of bitter gourd juice at least 3 times a day, 15 milliliters each, with breakfast, lunch, and dinner. Study 2 showed 1 capsule of 300 milligrams of Bitumelin peptide before lunch and dinner each day, and study 3 showed 60 milligrams per day for about 4 weeks for that study. And all trials appeared to be effective in lowering blood sugar levels in diabetics, as well as lowering A1C levels over time. And only 1 trial showed 1 side effect, which was a slight increase in cholesterol level. And the only major concern was the sample size as well as the duration of the studies. Moving on to therapy 2 that can be used to combat diabetes mellitus would be cinnamon. Cinnamon is a spice obtained from the inner bark of several tree species from the genus Cinnamomum. There have been several studies done to show the effectiveness that cinnamon has against diabetes. Cinnamon is loaded with antioxidants that decrease oxidative stress, which may be beneficial for several chronic conditions, including diabetes. And several studies have shown cinnamon has the potential to increase insulin sensitivity, decrease blood sugar levels after eating, as well as reduce the risk of diabetic-related complications. The first clinical trial we're going to look at is a randomized control study. This study was conducted over the course of 60 days in Pakistan. The participants were 60 people with type 2 diabetes, from 30 men and 30 women. They were divided randomly into 6 groups. The methods was group 1, 2, and 3 consumed about 1, 3, or 6 grams of cinnamon daily. Group 4, 5, and 6 were given placebo capsules corresponding to the number of capsules consumed for the 3 levels of cinnamon. The cinnamon was consumed for 40 days, followed by a 20-day washout period, and the results was as follows. After 40 days, all 3 levels of cinnamon reduced the mean fasting serum glucose level from to about 18 to 29%, triglycerides from 23 to 30%, and LDL cholesterol from 7 to about 27%, and total cholesterol 12 to 26%. There were no significant changes were noted in the placebo groups. There were changes in the HDL cholesterol. The changes in the HDL cholesterol were not significant, And the results of this study demonstrates that an intake of 1, 3, or 6 grams of cinnamon per day reduces serum glucose, triglyceride, LDL cholesterol, and total cholesterol in people with type 2 diabetes. The only limitations was the duration of the study lasting about 60 days. And there were no known side effects or safety concerns. The second clinical trial we're going to look at was also a randomized double-blind. This study was conducted over the course of 4 months in Germany. There were 79 patients diagnosed with diabetes mellitus type 2 on insulin therapy, but treated with oral anti-diabetic or diets. The 79 patients were randomly assigned to take their cinnamon extract or a placebo capsule 3 times a day for 4 months in a double-blind study. The amount of cinnamon extract corresponded to 3 grams of cinnamon powder per day. The results was as follows. There was a significant higher reduction in the cinnamon group at about 10.3% than in the placebo group at about 3.4%. No significant intragroup or intergroup differences were observed regarding the A1C level, lipid profiles, or differences between pre and post-intervention levels of these variables. The decrease in plasma glucose correlated significantly with the baseline concentration, indicated that subjects with a higher initial plasma glucose level may benefit more from cinnamon intake. The only limitations was the duration of the study, and there were no safety concerns. And the last clinical trial we're going to look at was a randomized control study. This study was conducted over the course of 12 weeks in Iraq. The participants, there were a total of 25 type 2 diabetic patients of both sexes who were diagnosed with diabetes between 5 to 10 years, broken up into 2 groups. Group A includes 12 patients, Group B includes 13 patients. The methods were as follows. The cinnamon powder was obtained from a local market and approved by a medicinal plant center in Baghdad, Iraq. Group A was treated with a placebo capsule dosage form, and Group B was treated with a cinnamon powder of 500 milligrams in the form of hard gelatin capsules twice daily. The results was as follows. There was a highly significant reduction from about 10.12% of the fasting blood glucose levels after 6 and 12 weeks of treatment, 10.12% and 17.4% respectively, compared to the baseline value and to the placebo group at corresponding duration. So this shows that an intake of 1 gram of cinnamon for 12 weeks reduces fasting blood glucose among poorly controlled type 2 diabetic patients, as well as showing improvements in the oxidative stress markers. The only limitations was the duration of the study, as well as the sample size potentially not being large enough, and there were no known safety concerns. The evaluation for all 3 studies is as follows. Study 1 shows that 1, 3, or 6 grams of cinnamon daily for 40 days. Study 2 shows that cinnamon extract or a placebo capsule of 3 grams was taken 3 times a day for 4 months. And study 3 shows cinnamon powder of 500 milligrams was taken in the form of hard gelatin capsules twice daily. And the general consensus of all 3 studies showed that all trials appeared to be effective in lowering blood sugar levels in diabetics, as well as lowering A1C levels, and there were no major health concerns as opposed to the sample size and the duration of the studies. Overall recommendations for therapies evaluated. Overall, both forms of therapy show a significance of aid against diabetes as well as complications diabetes may present. The recommendation for a healthy consumption of bitter melon ranges from about 50 milliliters to 100 milliliters. However, more research is still being done to gauge the most appropriate daily intake of bitter melon. And the safety recommendations for cinnamon intake is regarded as 1 to 3 grams a day. It is important to note that the effectiveness of these therapies can vary from person to person, so it's essential to consult with a healthcare professional before you determine the most suitable treatment plan. And some alternative therapies we have presented in this slideshow that can also help manage diabetes is one of them is known as TCM, or traditional Chinese medicine, which has shown promising results in type 2 diabetes clinical studies without causing the types of side effects associated with standard pharmaceutical treatments. And stem cell therapy. Stem cell therapy has emerged as a key player in treating type 1 diabetes, and recent developments in stem cell biology have generated excitement for B cells replacement strategies. There is growing evidence to support the use of stem cell approaches to enhance the therapeutic outcomes for type 1 diabetics. And it's also important to note that the effectiveness of these therapies as well can vary from person to person, and is very essential to consult a healthcare professional before you determine the most suitable treatment plan in either therapies mentioned in this presentation. And last but not least is my reference page if you would like to learn more about some of the information that was presented today and you would like to utilize the information. Thank you so much, and take care.